So anyway, moving on to another intervention that can be helpful for reflux. Fasting, 2023 clinical trial, again, kind of small, 25 participants. They consolidated their eating to an 8-hour window. And what they found was that after 2 days of intermittent fasting, they had improved reflux and improved heartburn. And to quote the researchers, our data shows that short intermittent fasting improves symptoms of both regurgitation and heartburn. A simple tool you can use. An 8-hour feeding window is not super hard. It's not a multiple day fast. So it's something for a couple days, in this case 2 days, could be helpful in reducing inflammation and improving your reflux. And then the final study here as it pertains to reflux I wanted to share involves something we've discussed on the podcast before, curcumin. This anti-inflammatory spice. And in this trial, 15 patients with dyspepsia, so indigestion. This was 151 patients, so it's an even better sample size. They compared omeprazole, aka Prilosec, against curcumin. And they found equivalency in the outcomes, which in my mind is absolutely amazing. So instead of using omeprazole and suppressing acid, which can have some deleterious benefits, I do think acid suppression in the short term is justifiable. Is it ideal? No. Is it justifiable? Yes. You have a different option of curcumin at a dose of 1 gram per day. And that has been shown, again, from this trial to be equivalent. This led the researchers to comment as follows, quote, curcumin and omeprazole had comparable efficacy for improving dyspepsia. So fantastic news. Growing evidence for natural medicines, in this case, curcumin and its efficacy for reflux. Part of what's happening underneath the hood with curcumin, as I mentioned a moment ago, is its anti-inflammatory action. Now, specifically, if we want to get a little bit down into the weeds, curcumin, amongst other mechanisms, suppresses a pathway known as NF-kappa B. This is an inflammatory pathway, and the expression of NF-kappa B can lead to inflammation, and the suppression of NF-kappa B, which curcumin does, can reduce inflammation and therefore improve reflux. So regarding reflux, some great options for you: gluten-free, low FODMAP, fasting, and curcumin. Again, simple things that you have ready access to that may improve your reflux and also improve other symptoms at the same time. And then finally, let's talk about food reactivity. One study that I found fairly noteworthy documented that stress increased food reactivity. Now, if you're stressed, hang on, I'll give you a solution in a moment. Well, let's just first identify the connection. They looked at just under 800 patients with IBS who had psychological distress, and they noted that that stress correlated, again, with increased food reactivity. Quoting, "We found that a higher score of psychological stress was associated with greater food reactivity." And part of what's going on here, and this is from Barrett and colleagues, and I loved this study. What they examined in this study was the blood of people who are high stress or low stress. How they assessed their blood was injection of LPS, lipopolysaccharide. This is one of the things that leaks through a leaky gut. And they found across the board that those who were more stressed had a higher inflammatory response to that LPS, and the people who had less stress had less of a response. So we know that stress can alter your immune system and make you more pro-inflammatory. But here is the good news. Interventions that reduce stress have been shown to reduce at least the symptoms of IBS. So this enters a 2023 randomized control trial. People received either general IBS advice, again, what you might get from your GP or your gastroenterologist, or they did yoga and meditation for 1 hour per day. And they found that the yoga and meditation led to reduced stress and reduced IBS symptoms, kicker here, without any changes to their diet. So if you're not doing something, it could be as simple as walking in nature, it could be yoga and meditation. Remember how powerful these are in improving your gut health. And one of the main reasons why I want to sort of underscore this is so that you don't jump too quickly to testing and to supplement, and you start with lifestyle and food first. There's more good news here. A different study looked at a CBT app, a cognitive behavioral therapy app, and they found that compared to the control group that received what's known as a waitlist control, the app, known as Remedy, led to improvements in fear of food, into catastrophizing one symptom, so thinking about their symptoms, being worried about their symptoms, and improvements in IBS symptoms. Quoting, "Remedy is a promising and effective way to help those suffering from IBS." And this is something that we've started integrating into some of our clinical recommendations in our practice, because some people need some help sort of unwinding a unhealthy association that they have with food. So wonderful options, whether it be yoga and meditation, a cognitive behavioral therapy app, which is really convenient. There are options here to reduce stress and to reduce food reactivity and the symptoms of IBS. We've also done a video on food intolerances, so if you wanted to take a deeper dive specifically on food intolerances, that resource is available for you. Remember that natural options are plentiful, whether they be dietary, exercise, yoga, meditation, walking in nature, or just walking in general. And various supplements, ginger, curcumin, probiotics, can all help you improve your health. And this would not be just consolidated to your gut health, but would permeate beyond that. Because remember, in some of these studies, there were other improvements beyond just gut health. And it's routine to see people who have, let's say, better regularity, have better body odor and skin, or who have less abdominal pain, sleep better, and therefore may have better mood and mental clarity.